Hi, my name is Tori Piacquadio. I'm a nurse anesthetist at St. Vincent's Medical Center.
What is your favorite thing about IAA?
I would have to say my favorite thing about IAA particularly is the fact that the integration of interdisciplinary teams, so the anesthesiologists, the surgeons, the nurses, the nurse anesthetists, everyone is very collaborative and welcoming, and as a new graduate nurse anesthetist, it was a great place for me to start my career.
What was your path to becoming a CRNA?
Yes, so I trained at Yale New Haven School of Nurse Anesthesia, and we rotated here at St. Vincent's for some of our specialty cases. And I thought it was a very easy and smooth transition from being a student registered nurse anesthetist to a certified registered nurse anesthetist, just because I was not only familiar with St. Vincent's, but I was familiar with IAA and the people that are so important and help run the organization.
How would you describe the work environment at IAA?
I have to say, come to work. I love coming to work every day. The anesthesiologists particularly treat you like you are a person, and they, respect you. And for a nurse anesthetist, it's very unique because they can help you kind of develop your practice, and they have trust and respect your ability to provide competent care. So I do love coming to work, I have to say.
How would you describe the clinical environment at IAA?
So clinically at St. Vincent's here, I love being part of this group because we do a lot of diversified casework. So we're expanding our practice with new surgeons, and so as a new nurse anesthetist, you really get the opportunity to have a diversified caseload. So you can work with certified anesthesiologists for regional techniques. You can get some traumas, you can get some hearts and heads, and there's always a variety of things for you to do and for you to learn. So clinically, I think it's been wonderful.
How do you manage work-life balance?
So the work-life balance, definitely, we have increased our volume of surgeries. So, we've increased our cases, which has been a good thing for the hospital and for, learning purposes and diversified purposes. But they always do their best to try to honor your previous commitments, or if you have a certain schedule or time constraint, they do their best to get you out on a favorable time or even before that. So I haven't had any issues, which is good.
Why IAA?
Absolutely the people. So I looked here and only here because when I was a student and I was training, I got to work with a lot of the partners and as they're here, and they were phenomenal. They are awesome people, not only practitioners, but they are well-rounded and competent providers, and they care not only for their patients, but they care for their staff. And coming to work is definitely a joy versus a chore. So it's definitely the people.